you are my 10 o'clock, right? Right, here you are, your pencil here. It's your, so I just want to take some basic information from you today, just so that we can keep it in our records and, best help you in your sleep journey, because, it depends on how you respond tonight, how many treatments you may need, here at the sleep lab, or how many monitoring sessions that you may need at the sleep lab. So I'm just going to ask you some basic questions and get your information, and then we'll get started. Is that okay? Great. So, could I have your last name, please? Okay, great. And your date of birth? Okay. And your address? Oh, you've moved. Okay. What's your new address? Okay, great. Great. Oh, it's a nice part of town. Yeah. So what symptoms do you think that you're experiencing? Like, what is preventing you from getting a good night's sleep? Is it things like, do you feel overly anxious? Do you feel, like your mind is racing when it's usually time for you to go to sleep? What are some of your concerns? No, these are all valid concerns. Go ahead. Right. And you're a little anxious as well. Okay, that's no problem. Would you call your lack of sleep insomnia, or just simply restlessness? Okay, restless. And when you feel restless, excuse me, when you feel restless, what brings on that feeling? Like, what triggers you into feeling restless and not being able to go to sleep when you're actually trying to go to sleep? Okay, so it's mostly you're feeling anxious and a little bit, mostly anxiety driven, right? Would that be a fair assessment? Okay. All right. That's reasonable. Sure. No. Any concerns or anything that you feel is worthy of discussion, I want to hear. Okay? Yeah. So tell me anything. Okay. Okay, no judgment. That's, yeah. Keep going. Okay. Right. And does that usually last all night into the morning? Or is it something that affects you like in the wee hours of the morning? Like, do you get up in the middle of the night, or do you generally feel like as soon as you try and, lay your head down, you can't go to sleep? Oh, okay. So it's intermittent. Okay, no. It's absolutely fine. These are all good things to know and to hear. Yeah. Again, anything that you feel is a valid issue or a valid concern, I want to hear, because I'm here to help you. Okay, great. All right. And my final question: how did you hear about the Bean Sleep Lab? Okay, you were referred by a friend. Okay, excellent. That's what we like to hear. Great. So, I'm going over this checklist that I have, and it seems like, so I basically, let me explain. I use a checklist to determine what type of treatment would be suitable, for you, or whether or not you need treatment treatment or just simply monitoring. But I think in your case, we're gonna opt for treatment, right? Right. Okay, so based on my checklist that I have here, I think that you would really benefit from what we call our brain scratching technique. I know it may sound a bit weird, but I really think that you would benefit from our brain scratch treatment, our brain scratching treatment. So if that's something that you would be in, and it's all audible, like I'm not going, this isn't a surgical procedure or anything like that. I am just going to subject you to a series of sounds, and it's going to give you the sensation that your brain is literally being scratched, and this sensation should help soothe your anxiety and also, get rid of that feeling of restlessness and make it easier for you to go to sleep. So if that sounds like something that you would be interested in tonight, I am more than happy to do that with you. Yeah, okay, perfect. So first things first, I am going to touch you a little bit, and I would like your consent before I start to do that. So is that okay? May I touch you? Great. Okay. So first things first, I'm just going to make some swooping motions around your face, just to kind of acclimate your body to the sound of my voice and the touch of my hand. So feeling your face. Nice. Great. Excellent. Now, what I would like to do is start the brain scratch. So these sounds that you're going to hear are going to be amplified and should, like I said before, give you the sensation of your brain being scratched and you not feeling as anxious or as restless as you've been feeling in the past. So I am going to give you your first trick. I also would like to test really quick